Are you ready for All Access Sports Medicine, the team that treats at the highest level with cutting-edge medical care?
Welcome to All Access Sports Medicine, your weekly dose of sports medical information.
Weekly dose we're going with this week.
Weekly dose of sports medicine information. And as always, I'm your host, Adam Slayman. I have to my left Dr. Jeff Pierce from Michigan Sports and Spine Center. To my right, I have Dr. Dana Ponners from OMPT Specialists. So happy to have you here today. So happy to be talking with everyone on this beautiful day. Oh my goodness. Did we hit 60 today?
We
did in my book, I'll tell you.
67.
Driving here was 67
Okay.
on my car.
Is your temperature correct on your gauge?
I go by it.
A little late than never, but it came, didn't it?
No, it's here.
Yeah.
Someone sent me a meme. Because of everything being delayed, the snow the other day, I should read it, but basically it says, because of the supply chain has been so delayed, we've delivered your snow on last Monday.
Oh, gosh.
That's clever.
You know,
like
put
that.
up.
All right. Come on, Spence. Do we have something for me there?
Yeah, that was pretty good. That was a
Wait,
good one.
aren't memes
All right.
from like a decade ago, though?
It's what is now? Is it just
Isn't it
What's it,
TikTok now?
TikTok,
Memes?
just videos?
Yeah.
There's no memes are out, right?
We gotta pull you into 2022, Dr. Pierce.
I was just making a comment.
Who's sending you memes still?
Look, just because our host does, what do we call it? Jump roping to any song you can choose.
That's right.
That's true.
And you know what?
I don't know how to challenge that.
I am still here. I will say, if you have a song that you would like me to jump rope to, feel free. Send it into our show. Send it into whoever, and I will find it.
I'm gonna
and
think
I'll
of
jump
one.
to it.
Something from like
Can you
ACDC,
do-
like
Sure.
dun-dun-dun-dun-dun-dun.
Can you do the one by
dun-dun-dun-dun.
Def Leppard, our buddy
Yeah.
Joe Elliott?
You pick the song. Pick the song.
It's the most famous song.
Def Leppard.
Def Leppard.
Got it.
Do-
It's in.
You know Def Leppard.
I know
Dr.
that's a band.
pour
it's not
some-
pour some sugar on me.
Okay.
Ah.
That's a little risky.
Easy peasy.
You'll
Got
get
it.
a lot of certain fans if you play that one.
I'm thinking about a love song. What about a
Listeners
love
and viewers, listeners and viewers, next week you will see a video of me doing 15 seconds of Def Leppard, Pour Some Sugar on Me. Make sure you attend.
That's how we're going to start our show next week?
Yep.
All
Not
right.
in studio. I'll record it.
Okay.
All right. But getting out of all that, today on All Access Sports Medicine, we're going to be touching on a little bit of a very serious topic, but a topic that we have discussed with our hero of the month, the Jamie Daniels Foundation. But today we actually have a special guest, Dr. Eric Coffman, board-certified addiction medicine and family practice, also a fellow at American Society of Addiction Medicine. And we're bringing him today to talk a little bit about substance abuse disorders in one, adolescence, but two, in relation to sports, professional sports, but then also everyday sports and everyday people. So it's gonna be a great show today. A little bit more of a serious show for us, but
we don't usually like heavy, but
we don't like the heavy, and that's kind of why I wanted to before we get into the heaviness, I want to bring something a little more lighter. Doc, you were downtown today, or downtown Detroit.
yeah. So there was an fortunate thing happened today.
And what was this?
So our injections, because of insurances, and I will not get on my insurance kick, but we've had authorization issues for our injections, which led me to be done earlier and have the opportunity to call my friends with the Tigers and get, we were able to get tickets for Miggy's 3,000 hit.
Potential. You can't say
Potential.
his 3,000 because it never happened.
Well, it was a wonderful day.
Okay.
The Tigers played very well.
Mm-hmm.
And I would love to show the clip of his last at bat.
Well, why don't you give us a little insight on what happened?
So we're all up, right?
Yeah. Uh-huh.
Everybody's counting. We got to have 5 players. 2 guys had to get on for Miggy to bat in the bottom of the 8th.
Yep.
Okay, he's 0 for 3.
Mm-hmm.
He's not looking his best at bat. So,
Well, hold on. What do you mean? Is he sluggish? Like, how do you know?
I think emotionally, even at Miggy's level, his experience, he just
Nervous?
The guy
didn't feel comfortable at the plate.
The guy went 3 for 4 yesterday.
Yeah, no
and
pressure
to get
yesterday.
to get to 29.99. So maybe he was
amazing.
tired. He's a little older. He's tired.
Fatigue factor.
Yeah.
Give him a little Citron. We'll wake him up.
Well, is that going to put the juice in the
A
legs?
little energy into that. But no, on a serious note, it was an
Shameless
unbelievable
plug.
day. unbelievable fans. It was a great day. We had great seats, able to see some friends there, but they walked him.
Inexcusable. Inexcusable
But if you're a pure baseball fan, it was the right thing to do. But our fans felt that New York was being called a certain term.
Oh,
At the end, they chanted for almost a whole inning. And it actually didn't work out for New York.
Did you chant this?
No, but I actually saw a little kid almost trying to chant it. And I'm like, please don't do that.
Yeah.
Dad was chanting it. The little boy that was probably 4 years old. He knew better.
I do have to say though, before we're
over time.
Now we're getting a little bit over time, but I have to say it in this day and age, it blows my mind. You sit in those fans, you pay the money to buy the ticket, and then you record him hitting the hit with your phone in front of you. Like, you don't even see it live. You're seeing it through your phone.
No, you can hold the phone off to the side.
No, I mean, did you see the panoramic view of everyone standing up, and everyone is standing there going like this?
I was one of them.
Why?
I want to have record of it.
There are outlets out there that you will be able to see it over and over and over and over again. Why don't you take a picture of you in your seat? Hey, this was the game.
I did that too.
Okay, you don't need a video of him hitting
I'm
it.
videoing. If I go tomorrow, I'm videoing.
Man.
Are you going
Every
tomorrow?
time.
You're going to go tomorrow now?
Have you already called the Tigers?
I will. I don't know. I asked for a favor today. I don't know if I can get 2 in 2 days.
It's going to rain tomorrow.
It is?
Well, it depends on the time, but
It's a later game.
I'm not a
All right, now
person.
we're weather. Now we're 2 minutes.
Okay, now we're really
We're
getting
not
out of
into
whack
Dr.
here.
Coffman's
We're really
time.
so. You know what? We're gonna pull the ripcord on that whole segment, and we're gonna get into our show. So when we come back, we will be doing our medical topic on substance abuse in adolescents. We have Dr. Eric Coffman here giving us some insight on the topic. Do not change it. Stay with us when we come back. Medical
Welcome
topic.
to Michigan Sports and Spine Center, Michigan's top physical medicine, rehabilitation, and regenerative medicine specialists. We are a team dedicated to providing you with the very best in patient-centered care, including personalized, cutting-edge treatments for all musculoskeletal injuries. Visit one of our convenient Metro Detroit locations to get started with a comprehensive exam, pain management, biologics treatments, EMG testing, and more.
Let's take you backstage with our thought leaders of today on All Access Sports Medicine. Thank you to our friends at Michigan Sports and Spine.
Welcome back to All Access Sports Medicine. Kind of getting a little funky today, talking about Miggy not getting his not getting his 3,000th home run off a walk, but that's not why we're here today. We're here to talk with Dr. Eric Coffman, Dr. Jeff Pierce, and Dr. Dana Ponners on All Access Sports Medicine about SUDs, substance abuse disorders, but also within the adolescents. Dr. Coffman, so happy to have you on board today. Thank you for coming.
Having me.
Yeah. So Doctor, you're an addiction medicine specialist. Can you give me a little insight about what that is, and then how you're working with?
It's a specialty like any other medical specialty, where there's a board examination, there's training that has to be done in order to be able to take the board examination. You have to have a certain amount of experience. You have to do a certain amount of teaching to doctors that are students, interns and residents, to attain board certification or fellowship. So I've been doing this quite a while, since like 1978.
Okay.
So I've been treating people with alcohol and drug issues, both hospitalized and as an outpatient.
And across all ranges?
All ranges. The youngest I've ever had was 12. The oldest, 92.
Oh my goodness. 92 and 12. I mean, that's just...
Covers all life,
Yeah.
part of your lifespan.
So Dr. Coffman and I have been working together for a while, many years. We won't mention the years. He actually mentioned the big year, but he looks good though.
Does look good.
No,
I thought he was going to be wearing a white coat and all that stuff. But
We're over that. Like, if you can't figure out he's the doctor in the room, there's an issue.
I mean, I'm
Well, I thought
gravitating.
about that after we spoke. I said, I really don't want a white coat,
We're not the white coat team.
Okay.
We're all access sports medicine.
All right. You know
So
what?
the thing is, how do we
Comfort.
tie this into all access sports medicine is really what's going on.
Correct.
So, there's a few examples we have. There's a level of play that has to be done. These guys, I mean, I've been the team doctor. We've been in the field a lot. It's more like you say, it's every day. Like the Jamie Daniels Foundation is based on that age group of 14 to 24. Most of the time these people with addictions have started before the age of 18, or they've had their first experience with some type of alcohol or medication. A lot of people that, I refer a lot to you because of that, because I can take it to only so far. I want to identify a problem, if there is a problem, and then move on from there. Dealing with my office, dealing with pain and all that goes on. There's other options. And what I really want to get out of this show is, like, one, obviously your expertise, two, talk a little bit about the foundation and talk about red flags and things that we can do, because there is a stigma, there is an issue, there is a problem talking about it. It's like, how do we get by? It's like you're almost to the person where, how do we get it out of the house? How do we get it to a physician? How do we get them to you earlier? You're almost, when they're coming to you, there's obviously like a bigger problem.
Well,
right. So our whole thing with all access sports medicine is, what's the prevention? What can we do up front
Exactly.
to really do that? So that's kind of where I want to direct our conversation today.
Okay. So, when people, go in the hospital and they get a surgical procedure done, they have a painful medical condition, like, a disc issue with their back, or a broken bone, or they need a knee replacement or a hip replacement. They go in the hospital, they have the surgery done. This is, a painful procedure, and the immediate postoperative period is very painful. And those people need to have pain relief. There is no reason for someone in a hospital who is in a postoperative state to have pain. So the opioids are appropriate for them for 3 days or 5 days, or until they can begin a physical therapy program or some kind of program where they start to regain their functionality and start to learn to deal with whatever pain there is, and to hopefully adjust to it, and hopefully as they continue their mobility and their recovery to normalcy, their pain will subside. Now, in some cases, it doesn't always do that. And you have people who are genetically inclined to appreciate the opioid type drug more than others. It's estimated to be approximately 10% of any population, any sample of the population that you take. Technically that would include 10% of the people in this room, but we're not.
Fortunately, there's not 10 of us here.
Right.
Well, partials.
Is that based on chemistry?
I'm sorry?
Like that, when they say that genetically,
Yeah.
it's based on the
10%.
chemistry of individuals and
Well, no,
neurotransmitter stuff?
based on their DNA.
Okay.
People that develop addiction disease, and we should touch a little bit on the difference between dependence and addiction, because they are two separate things. Any person can become dependent on an opioid drug if it's administered to them regularly for over 2 weeks or
prescribed,
over a month or whatever.
Yep.
But a person who has an addiction disorder is going to develop another series of behaviors that are in addition to the dependence. So those are the people I think that you're talking about. That how can you figure the difference between the two? And the answer is you can't always. Because usually the person that has the addiction, you're not going to know they had the addiction until they start to display the addictive behaviors. Mm-hmm. And primarily the addictive behavior is the alteration and misplacement of priorities. So that instead of getting up and saying, well, I have to go to work today, and I have to, I have to get dressed, and I got to eat, and I got to drive my car, and the addict may say, well, I can do all that later. Mm-hmm. I have to get my dose first.
Yeah.
So it's a prioritization, or what's more important, my family, I have a family obligation. They'll get along without me. I'll be an hour late. So it's a misappropriation of obligations in life.
But is there also potential changes in behavior, like anger or kind of aggression and things like
Yes.
is that a potential sign as well?
Yes. Well, what happens is, they get into a cycle, and this can also happen with people that are dependent, but they can get into a cycle of, craving, then use, then withdrawal, craving, then use, then reward. They get a brain reward for that, and then withdrawal, and then craving again. So, and it just develops, just keeps going in that cycle. And what happens is they start to develop tolerance, and they need more and more of the same. We're talking about primarily opioids now, where they have to continue to repeat the dose and increase it in order to get the same effect.
And you're talking like a euphoric effect too from the medication.
Yes.
And that's part of it too, is that life is feeling different or better at that, and that's what I gain too. It's just like, you pick on, it's not just medications, it's alcohol, it's gambling, it's all that. It's that high you get, it's that internal high. But I think the biggest point he makes is that it's changing priorities. So when you start, like with a child, when we talked last week with the
Chris Perry,
with
executive
Chris,
director. Yep.
It's the young person where what's the habits that the parents need to look out for. Those are the kind of things. Like you look at the obvious ones. You're thinking more like steroids.
Yes.
When they're on steroids, they get that anger and they get rage and they just are inappropriate. I don't think addiction to like medication is the same. It's like they're kind of sneaking around. They're kind of doing things. They're like lost for a minute. We talked about they brought up big that you have to protect your medicine cabinet, things like that. I have close personal friends where the family has actually stolen things from the house, sold them to create money to buy stuff on the street. Those are the obvious ones. Those are the ones that when the family's in denial, you're in denial. There's a lot of families that...
And this brings in the topic of stigma and how it's a huge dynamic when it comes to the family.
But it's not just stigma. It's family dynamics. You go after that son who's large and, okay, let's just see how we can calm him down. You don't want to feed fuel to it. So it's a very, like I've complimented, like even Dr. Coffman, his levels of patience, but I think you pretty much have you try to be a black and white where this is where I draw the line, but we always creep around that line with a lot of patients that we give reason to. It's kind of guilt with an explanation.
It's not always that clear. The usual pathological display of behavior is usually more subtle, and it usually is something that evolves. It doesn't go from 0 to 10 immediately. It may take several months or a year, and and the parents may say, well, his behavior is different. He's not doing his homework. He's isolating. He's secretive. There's valuables missing from the house, and that creates a whole nother dynamic, which is the effect of the people that are in close proximity to the user, and they develop their own illness as a result of that, called codependency. And that's a whole separate illness with a whole separate treatment associated with it. And part of that illness is that they inadvertently enable the person who is continuing to use. So
but they do it out of love too. The enablers are usually loved ones.
Yeah, that's the dynamic. It's the people that are close to them. So that's I think one of the origins of the phrase tough love is that if you love them enough, you have to understand that you have to set certain parameters of tolerability as to what you're going to do in order to help them get better.
But even like a lot of friends, and you and I have had these conversations in a lot of arenas that I don't understand why they're doing it. There's true pathology. Like Darren McCarty talks about it well. I played all these years. I didn't understand. It's a true illness that needs to be treated. And the other side of it is I feel a lot of doctors are over-treating right now. There's too much medication going out. There's too many people being put into that bucket of, attention deficits, anxieties, panic disorders. I mean, we're losing our true non-pharmacologic coping skills, which it's mixing into where it's hard to identify the people with the real pathology.
But in this day and age, of saying, if I do something, I want a immediate response. For instance, I go to a website, I want that website to come up, I want to click there, I want that thing, boom, and if my internet's slow, I'm freaking out. Do you feel
the phone?
But do you feel that type of behavior is a learned behavior, and over time, it's creating this issue that when I get hurt, I have back pain, I have neck pain, I have knee pain, I want this pain to go away. When I take this medication, it goes away. It's not going away because it's not fixed.
Right.
And that is a huge part of why we're here talking, and of course, bringing you from Michigan Sports Spine.
That's the impulse, the impulsivity and the need for immediate gratification. That's part of the whole dynamic. It's a whole universe of issues. And that's one of the things that comes to people's attention, especially people that are close to the person who is actually using the drug. And Dr. Jeff was talking a minute ago about the medical profession over-prescribing for people, and what happens is frequently these people come into me, and lately, more than street drugs, I'm seeing people that are having problems with prescription drugs, or they started with prescription drugs. They started to exceed the amount that the doctor was comfortable prescribing for them, and then they would seek their additional dosages on the street, which is extraordinarily dangerous because of the pervasiveness of fentanyl and the unpredictability of the dose of fentanyl that a person's going to get. I have people who think they're smoking street marijuana, and their urine drug screens show fentanyl in them. So the fentanyl is pervasive. It's anything that's acquired on the street can have fentanyl in it. Very dangerous and very risky. But most of the people that come in now, as opposed to being street addicts, for me, are people who are taking multiple prescription medicines, and they're going to multiple different specialists. So they're going, like the doctor said, one doctor's giving them Adderall, one doctor is giving them Xanax, one doctor is giving them oxycodone, and that's how their life goes.
Correct.
So they go from prescription to prescription, and their life is in monthly intervals of how they're going to get their prescription. So, the difference is, what I try to do is get them off as many of the drugs as possible, get them stabilized. If they have a chronic painful condition, and many of these people do have chronic painful conditions, and the public's and the sentiment in the medical community prior to this was, you have to treat their pain. You're not treating their pain enough. You probably remember this, Dr. Jeff. Give us a scale on 1 to 10 how severe your pain is. And we have to get you rid of your pain. And these people get dependent on opioids literally for decades. And then, the public sentiment shifts all the way to the other side, and everybody's getting too much pain medicine, and we have to cut out the pain medicine. And then the doctors get freaked out, and they cut these people off. And these are not all addicts. These are people that became dependent because of the medical profession. And what are you going to do with them? When they have chronic opioid exposure, their brains undergo a transformation. Their brain chemistry has been altered substantially, and they can't function without the opioid being present. So fortunately, there is another drug called buprenorphine that's 1,000 times safer than a pure opioid agonist, that we transition people to, put them on that, and then we slowly, artfully taper them off of that. But it takes a year to do it, because that's the extent of the damage that's done to their brain chemistry from their chronic opioid exposure.
Can I go back to where you were talking? Because I see people post-surgical as a physical therapist.
Closer.
And so they are coming with the opiate drugs, and they do need them. They need them to come to physical therapy. So at what point is there a red flag? Like, is it 2 weeks, 3 weeks, 4 weeks? Like, if they're taking it regularly, that their brain is changing chemistry, or is there an addiction point, or is it different?
You mean, so
what's the red
what's
flag
the context?
point?
You mean like
they
just had a surgery?
Let's say post-surgical, total knee replacement. And
total knee replacement.
Anything, like any surgery.
Okay, the level of postoperative pain is going to be different depending on the surgery. I think postoperative knee replacement is one of the more painful procedures. You know, you can have like, I would say 4 to 5 days. I mean, you have to be able to perform the physical therapy on them. They have to be able to do the range of motion in order to get their function back. And sometimes, you know, there's postoperative inflammation and swelling, and they can have difficulty with that. And the pain can be prohibitive in their progress. Yeah. So they need the pain medicine for 3 to 5 days. And then after that, they really need to start cutting the pain medicine down and relying more on the therapy. The therapy, let's face it, is harder work than taking a pill, but the benefits are higher. So
So if I have these people on pain meds that are opiates 3 weeks post, is that a red flag for me? Or, I mean, like, not overstepping my boundaries, but is that where the chemistry is changing and they could be going into an addiction stage? Or
it's all case by case. I mean, ideally, like Dr. Coffman said, 3 to 5 days, boom, you're gone. You know, you got people that are like, I'm only going to take a Motrin. I'm going to do this. There's certain mental capacities. If you have someone who's like, hey, if he's coming, I think I'd be more red flag. They're like, my doctor's not giving me enough medication. They're not taking care of me. They're not taking me serious.
Those types of questions, yes.
Those are the kind of things I would say are more red flag. Hey, I took in 3, I'm down to 2. I'm increasing my activity, so I've had increased discomfort. I'm doing therapy. I mean, how many times I'm in a situation where we write, you know, pain meds to be given an hour before therapy so they can tolerate their therapy. So it's case by case. If you do go, I mean, I'm not overstating, but if you do go, ideally, 3 to 5 days, boom. Ideally, nothing. Post-op needs, the other thing that's going on with our procedures, they're less invasive. They're less intrusive. You're not filleting people open anymore. You're doing minimally invasive procedures where we're seeing a lot less medication. I mean, we had pain drips. I mean, we ran if you go on a pain
like a
service at the hospital, everybody's on a morphine drip. You know, we're not seeing morphine drips like we used to. So it's because of, you know, get them out.
Advancements in technology of the procedures.
But there's someone that's, they were on opioids for 20 years, and now that's a more difficult person. That's someone we need to deal with. A lot of times with post-surgical stuff, especially spine, people are on narcotics before. They're going through that procedure. Now you got to up it for that period of time, but then you're going to get them off. I mean, my biggest comment to new patients is you're going to hate me for 6 months. Okay? You're on these narcotics, and I didn't want to go this direction. I want to go towards the more red flags, but when you're on medications and you come in and tell me you're 10 out of 10 pain, how many narcotics are you taking? I'm taking 4 to 6 a day. Well, how's that working out for you? So now that's a red flag of where's your focus? Like you mentioned, there's a change of focus in these people. So right then, that's a red flag for me, right? You're 4 to 6, you're doing everything, you're functioning. You know, how'd you get here? Well, I walked in. How'd you get from the car to the office? Oh, I walked in. If you're truly in pain, you're having difficulty getting from point A to point B. So what do we really, you know, those are the kind of things. And that's more of a seasoned physician. Young physicians, I mean, not that I am seasoned. I mean, we see so many things.
Yeah.
I mean, you get to see so many things.
It's experience.
Well,
but yeah, I think we're going over.
The other thing is,
real quick,
they get tolerant to the medicine.
Yes.
And then when they try to reduce their dose, they start to have withdrawal.
Which is fine.
And the first manifestation of their withdrawal would be an intensification of their original pain. And then they get the whole body aches. And, you know, my pain is worse. I need to take more. But what's happened is that they have developed tolerance to their current dose, and they need to now increase their dose in order to feel normal. Most of these people on chronic opioids are just taking them to feel normal.
Right. But then we also have other things. Like I always say, and these aren't the people we want to talk about, but since we are, I want to treat what do you, my biggest question right now, and you should ask, why are you taking the med? What is hurting you to take that med? If it's your back, okay, I'm going to identify what's wrong with your back, and we're going to treat that, and then you're going to be better. And there is a psychological play to that too. You know, they've been telling him, well, I need the medication. Well, if I have this medication, I'm seriously something wrong with me. The doctor thinks I need a narcotic. I'm seriously something wrong. And then they're playing in, and then that's the medical community not doing the right thing. That's why you're hearing about wellness programs, holistic programs. all that, which is really what we push at Michigan Sports and Spine and on All Access Sports Medicine.
And
that'll be your break.
And
moment.
that's what I'm trying to say. I'm trying to say is the reason why we have these types of conversations is, one, to bring thought leaders into the forefront to talk about topics. Today's topic, it's a little heavy. It's a heavy one. I'm feeling it just kind of circling around me, but that is allowing us to bring exposure to it, and by bringing exposure to it, we talk about the prevention opportunities. We talk about these are red flags, not only as a parent but also as a physician. We have three doctors in the room talking about it, and that is why we're here. And we're excited to have you with us. Don't leave. Don't go away. When we come back, we're going to be talking about one Tyler Skaggs story, Angels pitcher. It's a story that fits into this, but we will also talk about Riley Green and his foot injury that we missed last week. So stay with us when we come back. This is All Access Sports Medicine, and that was brought to you by Michigan Sports and Spine Center. For over 25 years, Michigan Sports and Spine Centers have been providing complete care in the world of sports medicine, rehabilitation, and regenerative medicine, using cutting-edge treatments and dedicating themselves to overall health improvement. Their patients recover at rates well above the national average. To schedule an evaluation or to find out more about their services, call them at 248-426-9944 or visit them online at michigansportsandspine.com.
When you need an MRI exam, come to the facility that makes your comfort and exam quality top priority. MRI of Southfield provides Metro Detroit's most advanced imaging while maximizing patient comfort. Our truly open Hitachi Oasis system features an unobstructed viewing angle and the most accommodating patient table that no other MRI system allows. Patients and their doctors enjoy fast results without compromising safety, performance, or efficiency. Contact MRI of Southfield today to schedule an appointment or to find out more about insurance and pricing.
Welcome back to All Access Sports Medicine on Woodward Sports. Here's your Medical Minute, powered by MRI of Southfield.
Welcome back to All Access Sports Medicine. Doc trying to put his earplug in. I mean, we're really quick here. We do a lot of transitions. We try to make it a little quick and airy. But yes, this is a little bit of a heavy topic. And you know what? This is awesome. I just have to keep it going. Play the, yeah.
He's trying.
Just go.
Go, Doc, go. Put that earplug in. Yeah.
Hey, how we doing?
Yeah. Okay. Thank you. You
All right,
got
this
it?
is the lightest moment of this whole
All right.
segment.
Well,
We needed
welcome
that.
back
We
to
needed
All Access Sports Medicine. Had to give you a little fun and laughter there. Doc, can you hear with that thing in your ear?
I can hear you just well.
All right.
Just swell.
It's upside down, so he's hearing backwards.
Hearing upside down.
It actually sounds better.
The snozberries takes like snozberries. All right. Yes. Welcome back to All Access
Coffman
Sports
has
Medicine.
no idea what he's in
He's
for
just
here.
like, oh my goodness, this is awesome. This is awesome. We're talking about substance abuse
have to make some
disorders.
lightness of it.
We're talking about substance abuse disorders, but I want to kind of bring it into the professional athletic world. Doc Pierce from Michigan Sports and Spine Center has worked with professional athletes of all kinds. Dr. Dana Ponners has worked with professional athletes of all kinds, and of course, Dr. Eric Coffman has worked with professional athletes of all kinds. The big story that came to the forefront, I don't call it fruition, but came to the forefront a couple months ago.
It's an outlying story.
Is the Tyler Skaggs story?
Yeah, it's an outlying story.
And I think what I want to kind of touch on is these are disorders that are affecting everybody, not just because they're celebrities, but all ranges of individuals. But we want to understand how to make sense of where it is, maybe in the professional world, and then how we can bring it into the prevention again within the home front.
So why don't you give a few for people that aren't familiar with this
Yep.
story? You want to summarize it?
Go ahead.
No, you can do
All
it.
right, so Tyler Skaggs, pitcher of the Angels, ended up losing his life a couple years ago.
Phenomenal player.
At
At the top of his game.
correct. On their way to Texas to, play the Rangers. From there, he ended up receiving some prescription drugs. Through this concept, he then took these prescription drugs in his hotel room and then was found dead the next morning. But the story progresses where he was receiving these prescription drugs from a group or an individual from the team. I heard it was from the communications director. Doc, you had a different insight on that.
We're not going to go into the details because it is a legal matter.
Correct.
The thing is that this got to a legal matter.
Correct.
So I've been doing with athletes of all levels, including professionals, for years, right? When we look at and we cheer these people on, and we always talk about the NFL, everybody's out watching the game on Sunday, and how do these guys battle and how do they feel on Monday? They're banged up.
Yeah.
They're in pain. We're talking about a pitcher right now.
Yep.
You got to understand, and some of the stuff that was disturbing, and maybe in hindsight, nobody had a malignant. It was all in friendship of giving him advice. But when you start adding it up, and then you can put a microscope on it and look at a 5 to 6 to 7 year trend, what happened, you're kind of taking it with a biased eye of you weren't making those decisions on a daily basis. Giving someone narcotics, giving them things. I mean, do professional athletes take hard medication? Yes.
Yes.
Do they get pain? I mean, hockey's the best example. These guys play through broken limbs.
They play with stitches.
Yeah.
Who does that?
Cut me up and I'm going back in.
Stitch me up and go back in.
Yeah, I mean, we put a little numbing medication, but you've got to understand the pressure they're under. That's their job, right? Every one of those players has someone behind them looking at his job. So this pitcher and his agent said some things that said, look, you're in contract year. You have not been performing well. You can't have another injury. That's the thing we talked about prevention. He had one injury that led to a couple different injuries because his mechanics were off, because he's forced to continue to play at that level. We look at players now. Why are they coming out? We're complaining about how many days off players are taking in basketball. We're now complaining about the Tigers, how many people are on the injury list.
Soreness, yes.
We are allowing them to leave the game with less of an injury than we would have 5 years ago, definitely 10 years ago and 20 years ago. Mm-hmm. I mean, I'm old enough that it was smelling salt on the sideline, wake them up, tell me your name, you're good to go. Now it's you got to go into a tent, a third-party physician comes in, an unbiased individual tells you can't play. The coach is like, and choice words, right? He's my star player. You can't be playing without your star player.
But shows like this and information that has been coming out across the entire world has brought things like that to say, hey, we need to look at this a little differently. I totally agree and understand the concept. If I'm a coach and my star player can't play, concept like that. But
I deal with it at a whole level. I'm dealing with a high school baseball coach right now.
Okay.
And I can't name him, but it's like he's got one player, has a scholarship for next year. He's a senior player. He's a utility guy. He's got him pitching, catching, and playing shortstop. And he's got a bad shoulder. Mm-hmm. What's the outcome of this guy when he's entering his college scholarship?
He's going to push.
No, because he's seen a physician like us and say, what's the priority?
Oh, very good.
There it is.
And no medication was given to him because I'm not going to do it. People now are like, well, if I do that injection and I go back and play, do I do more damage? 15 years ago, I didn't get that question. It's now there being more awareness. There's more long-term thinking. We're a little bit smarter, but stuff like this where I kept saying quietly, this is an outlying.
Yeah.
This is a very sad situation will bring light to the system. What this has done is put the whole organization, the money makers, the guys selling, everybody on notice that if you're injured, you're letting that person sit out.
Correct.
Nothing is worth it. That guy might not get the big contract the following year. He may not get Matt Scherzer type of money, but it's where you choose, right? Like Jeff Goldblum said last week, we talked about golfers. We talked about golfers that they get a 5-year run. They don't care about their body. You talk about football players. I'm playing for, their average thing is what, 2.5 years?
3, I think, linemen.
3.2 years or something.
Goodness.
Yeah.
They have to make money. You look at Tom Brady. He's an outlier. Don't look at Tom Brady. Look at the averages. Look at what the majority are, right? That's where you need to be. So I don't want to get into the details because if you peel this thing back, it's a sad story that a microscope from a lawyer was looked at, and it will change the game.
Correct.
It will change the game. It will change the trainers. It will change look, there's medications. Everybody's trying to get an edge, right? LeBron James, what's his edge? Nobody can figure it out. He's phenomenal. Is he a phenom of human bodies? Yeah, probably.
Specimen.
Was Jordan? Yeah. These guys are outliers, but that's not who you look at. You look at the majority of people.
Well, I don't have an outlier, but I do have Riley Green.
Oh, God.
See? I'm good.
I'm not hating on Riley Green, but it's...
What?
Okay, go.
Oh, see
You,
this guy?
you got to tell him the truth about his injury. That's what people want to know. He's a prospect, and he's here.
Yes, Riley
He's got
Green.
a foot injury.
Right.
Yes, he's out. Foot injury. If you're
Do
playing...
not give him narcotics.
Okay. All right.
I will give him a sports
Okay.
cream.
All right. So then...
Let me fill you in on the foot injury.
All right, go ahead.
Go ahead.
So about 20 days
I'm
ago, a 97-mile-an-hour fastball foul tips off the bat and hits him right on the foot. Now
Correct.
it says that he sustained a fracture to a bone on the bottom of the foot. I didn't see the reel of it or anything like that, but that's what I read.
Yes. It's
okay.
because when you're swinging, sometimes your foot kind of slides out, shows the bottom of the
Could
foot,
be.
and then bang.
Okay, so it'd probably be the inner side of the foot.
Correct,
Your
correct.
foot has 26 bones. There's
Yeah.
a lot of bones. So there's a lot of bones that could be fractured there. So we don't know which one it is. But what we do know is you can get a fracture by a direct blow, a crush injury, or even by stress, like overtime stress fractures with running.
Mm-hmm.
When you get the crush or the direct blow, that's when you get, oh, look at Dr.
Yep.
Pierce, there's the foot. That's when you get more soft tissue injury.
Oh, yes. This is
So
last week's.
you have such a large amount of energy being exploded in such a small amount of time that you're going to get soft tissue, you're going to get tendon, you're going to get ligament, you're going to have a lot of swelling, a lot of edema to deal with. So that's the acuity of this injury as opposed to running and getting a stress fracture or something.
Correct.
So something like this.
So it's a bone
considering
contusion.
this,
Let's
with-
get down to it.
and everything else in between.
It's a bone contusion, which is actually can be more painful. If we're really going to talk about the end, you're going to force me into this.
I
Do
am.
it.
And
There
we
we
need to
go.
talk.
Force
They
me
want to
into
know
this.
times. That's the thing. If you read the literature, everybody wants to know, it's going to be longer timelines. So they're looking at timelines here.
But I mentioned this last week when we talked about it. You're talking about your foot. It's hard to come off. It's not a hand, right? You got to be on it. You got to be able to push off. You got to be able to rotate. You got to create torsion. There's rotation on that. You're talking about an injury, and we're showing the foot here now, but there's different bones, and I don't think there was any displaced fracture. There was a questionable
Just
fracture.
fracture, yeah.
But it's the bruising. A bone contusion is actually more painful because if you contuse the bone, it becomes a swelling into that area. So the bone doesn't have to fracture. It becomes actually more of an injury that can take longer. Bone contusions, sometimes you're better off with a fracture because you put the two pieces back together, you plate it, you heal it, and you move on. A bone contusion is like natural healing of the body.
And is it the pressure of this, I guess, bruising that's
Well, I'm
pushing
sure-
on the bone and the nerves that's causing that pain?
No, it's more ligaments. So the nerves are less involved in that part of the foot, but it's the tissues, it's the mechanics of it. Because there is a lot of bones, there's a lot of ligaments, and they all have to have perfect working order for you to feel well. You know, for him, I'm sure he's non-weight bearing. I'm
Yeah.
sure he's in a walking boot. I'm
Yeah.
sure he's getting treatment on a daily basis. But at the end of the day, like, you know, would we put PRP and stem cell? So I've argued with a few orthopedic surgeons, why do it? A lot of podiatrists will do it. I don't know if he did it. It's going to increase your healing cascade. I love saying healing cascade because that's
good term.
really what stem cell and PRP is about. It's our natural healing cascade, and we move into that it can't hurt. I don't know if he's done it. It can help the ligaments. It's going to advance the treatment of healing, that healing cascade. There's certain steps, and they all have to happen. Like I always use the example, when you cut yourself, you bleed, and then you clot, and then you scab, and then you get this scarring and healing. That's all the body doing it. I 100% always believe the body is the best mechanical machine we've ever invented. How it can self-heal, how it can birth, how it can do everything. There's stuff going inside your body, the damage you're doing by drinking certain drinks, you don't know, but your body's healing all the damage we're doing. Our McDonald's, our cholesterol. Your body is working against that you can't see. It'll work for him also. To give a time frame, which everybody wants, first of all, I don't know his personality well enough. His position should allow him to return a little bit better. He's not one of the.
He's
He's
21.
younger.
He's
younger.
20.
Yes.
21.
21.
Outfielder.
Outfielder.
He's
Yep.
got to
yeah.
run
Yep.
with a cleat.
Right. He's
and
got to run, but
different
he's
training.
not. No, those terrains out there are not rough. They're beautifully manicured. But it's going to be see how we do. And I think because he is 21, we want to make sure he's 21. He's healing way better than us back 9 people.
So there's a couple things. His age is going for him.
Yes.
Number 2 is that he's got the whole medical team helping him and rehab team. So they're minimizing his swelling, and he's doing rehab now in other parts of his body that's going to help him along. And then the third thing is, thank God, there are some bones in the body that don't have good blood supply.
Yeah.
One in the wrist that I can think of, femoral head in the hip that I can think of, but there are no bones in the foot. All the bones have a good blood supply. So there shouldn't be any complications with that. So, and the other good thing is they have x-rays that they're going to be monitoring so they can tell you when the bone is healed, and then it's the rest of the soft tissues and everything else and the weight bearing, and then going ahead and going return to sport. That's going to be the emphasis.
I will give myself one kudos story. You said there's a medical team. We've dealt with a college medical team, similar injury, and they ignored it and then put it off that he was being soft and everything else. He came and treated with us, and I think it's one of our testimonials on our site, and you can go credit me. But we did a PRP injection, we did advanced therapy treatment for his foot, and he actually was all conference player for the year. So we got him back mid-season to be all conference.
Check
and
mark.
that was
That's what it's about, right there.
local
Check mark.
college.
Bingo.
So I'm not asking to treat Mr. Green, but I would challenge the team to step it up.
This guy in the challenges.
I want to go back to DeChambeau. No.
Well, let's not open that up
He's going to
again.
be there tomorrow too. So
Yeah, man.
you're going to be at
there
Tigers
tomorrow.
game. They might come pull you out of the stands. You never
come talk to
know.
this guy.
They'll
Put a sign.
They can show you in the
they'll
Jumbotron there.
Escort me
Well,
out.
I think, talking about prevention, and then we're going to about to get into the hero of the month. My last question regarding the Riley Green story, contusion on his foot. When he starts to come back, we always talk about Dr. Scholl's and inserts and things like that. Are there things?
We always talk about it.
Well, I mean, you see it everywhere. And we
don't
talk
always
about it.
talk
the
about it.
world, the
We should talk
We're
about
all
it.
access sports medicine. We're above that.
My question is this: if I have this contusion, I'm an everyday person, maybe not Riley Green, hit my foot, have a little bit of the contusion bruising there. Can I put something in my shoe to assist in that pain?
You can
What
do
does that look
over the
like?
counter things. You're going to do softer inserts type things. You can do over the counters. You can be sent. You can get one made for you. There's taping that we can do, so we can do trial taping to see certain taping situations. There's different consistencies of tape. You can use different tapes. There's different ankle braces, ankle and foot braces that you can use. So there's a variety of things that we could step up or step down as you go and progress in your rehab process, but they're all going to come into play, even if you're not a professional player. And Amazon, as good and as
geez.
bad as it is,
So why'd
you
you
can
do
get these
that?
things to the patient now. I'm like, can you order this and bring this in your next therapy? It helps us so much in therapy. Can you order this brace and bring it in next time? Can you order this tape? Or if I have tape, we need a stiffer tape. Or
The
can you
young
order
people
this
are starting to
insert?
boycott Amazon.
And that's okay too. I'm just saying from a therapy
All right.
perspective, it's really good.
I'm pulling it off on
It's
that
never
one.
been so easy to help a patient quickly.
Yeah, it's
And-
true, and it's cheaper.
So, listeners, followers out there, talking about the different types of injuries. If you're following the Riley Green story, stay tuned. Maybe Doc will be on the field tomorrow.
He's at 3 weeks out right now.
But before we get back, we're going to be having the Jamie Daniels Foundation on for the Hero of the Month again. Looking forward to having the conversation with Lisa Daniels-Goldman, co-founder of the Jamie Daniels Foundation. When we come back, he'll be the Hero of the Month, sponsored by Light RX. And that was your injury report, sponsored by OMPT Specialists, a dedicated to proving you the best quality care by applying one-on-one customized treatment with the same highly skilled physical therapist for each visit. Each therapist is certified in orthopedic manual physical therapy, or OMPT, an advanced form of physical therapy that focuses on treating the cause of pain, not just its symptoms. To schedule an evaluation, call them at 248-353-1234 or visit them online at omptspecialist.com.
At OMPT Specialists, we focus on you by providing one-on-one care. And that's when you see the real results.
When I consider the one-on-one approach to physical therapy, I was really happy with that idea. We had been to several other physical therapy clinics, and OMPT just really stood out.
From back pain to post-surgical recovery to chronic pain, when your doctor refers you to physical therapy, opt for OMPT Specialists.
Hi, my Diamonds, it's Crystal with an X. You want to get hot and perfect like me? Here's my super easy routine. Drink at least a gallon of water before you wake up. Attach a weight to everything in your house. Hello? Sell your car and just sprint everywhere. Scream when you exhale.
Don't follow Crystal with an X. Do your own thing at Planet Fitness with tons of equipment and free fitness training in our clean and spacious clubs. Join now for just $10 a month and cancel anytime.
Fellas, let's be honest. We like things to be easy. We like simple stuff, like sports 7 days a week. We like things uncomplicated, like Lady Jane's Haircuts for Men. Open 10 to 8, 7 days a week. Walk in anytime. Sign in, sit down, watch your favorite team play, and before you know it, your hair will be game ready. Open 10 to 8, 7 days a week. Walk in anytime. Lady Jane's Haircuts for Men. It's wicked awesome.
Gain more confidence in your body with Light RX. We offer non-invasive treatment options like laser lipo, laser hair removal, and body contouring that deliver dramatic results with no surgery or downtime. Our expert staff will help you find the services that best fit your body goals. Save 70% on our favorite treatment plans and get ready to look and feel like your best self. Visit lightrx.com/Woodward Sports to learn more about this limited time offer.
Give it up for the hero of the month on All Access Sports Medicine, brought to you by LightRx.
Welcome back to All Access Sports Medicine. This is the Hero of the Month, sponsored by LightRx. We have the Jamie Daniels Foundation for the rest of the month, and we actually have Lisa Daniels-Goldman, mother of Jamie Daniels, co-founder of the foundation. Welcome today to the All Access Sports Medicine.
Thank you so much.
Yep. Go ahead one more time. I think your mic was off.
Oh, thank you. Can you hear me now?
Yes, we can. It's so nice to see you. Thank you so much for coming in today. Well, for being on today.
Yeah, sorry about that.
No worries, no problem. We again appreciate the time. We did have a conversation with Ken Daniels and also Chris Perry for the last 2 weeks, bringing you on board today to one talk about the foundation, what it means to you, and additionally, you have a comedy night coming up as well. So we want to just give you the time to have a conversation.
Well, thank you again. What the foundation means to me, it's everything. I can't say it's part of healing because you never heal from losing a child, but if we can help one person in their fight and with treatment with substance use disorder, then that's what we're going to do in Jamie's name. So he didn't die in vain. And that's the most important thing to us. And it keeps Jamie and his name alive for us because we can talk about him every day. And, we have the comedy show coming up, and Jamie loved to laugh. And May 1st, we hope that all your listeners will come and join us at Mark Ridley's on Sunday, May 1st. We have 2 shows, one starting at 1:15, the next at 6:15. Food is included. We have 3 great comedians, Ian Bagg, Craig Shoemaker, and Mike Young. And it will be an incredible show. And the funds raised, we have designated to donate to a brand new adolescent treatment facility opening in Troy, which should be up and running towards the end of this year, late fall into the winter. And we're really proud to be a part of that because treatment is necessary. And we know kids today, younger and younger, are getting into prescription medication that they're finding in their own parents' medicine cabinets or their grandparents. And we need to make sure that there is treatment available.
Exactly.
So why don't we take a step back a little bit, because some of the listeners won't know. So let's introduce kind of what the main purpose is of the foundation. You kind of touched on it in pieces, but if we can take a step back. I mean, last week I talked about what I feel is you guys are tackling an issue, and we talked earlier in the show about this. These are very hard topics. These are very hard things for families to address. And it is about addiction. It is about, creating a safe place for them to go. And the programs I think you're doing also the new place you're opening, but the facilities you're opening at the universities, I think, are very helpful, creating a safe place for them to discuss and get treatment at the university level, because like we've identified that age to 14 to 24, which is your niche that you guys are trying to accomplish, a very hard task, is working towards. So how would you describe, like, for our listeners that don't know a whole lot, I mean, we don't need to go into the details of what happened, but like, who is the ideal person that should be calling on your foundation?
Well, because Jamie was 23 when he passed away, and his death was the seedy side, of drug addiction, which was, the nefarious character. So when we thought that Jamie was being helped by doctors and treatment and getting him into the right programs, he was actually being patient brokered, and our insurance was being abused for tens of thousands of dollars. And one of the doctors is going to trial in October. Jamie is one of the victims named in the case, and that doctor was accused of money laundering and insurance fraud for over $700 million. But the point for the Jamie Daniels Foundation and the age range that we cater to is, we're not reinventing the wheel here. These are programs that are already established, that we know are either evidence-based prevention, or that they've been established, like our collegiate recovery programs, that we are helping build. So the funds that we raise, we have written over $130,000 in the last 3 years to these collegiate recovery programs and prevention programs for kids that are either in school, and it gives kids, adolescents, and young adults the opportunity to get back to their studies, and to learn at that younger age. They're getting younger and younger. It's not just high school, it's middle school, and they don't know what they're doing. They don't understand what they're taking and what they're finding. And these prevention programs that we support go into the schools and talk to the kids regularly. And those are the programs that we fund. So at the Jamie Daniels Foundation, we work on education resources for families and their kids who are suffering with substance use or feel that there is a need in their family, and we can give them some guidance and support in that area.
Thank you.
I think we have like one more minute, but we've been trying to talk about red flags and things that are outliers for the parents to look for in their children, to identify some of the issues that, hey, we're going to call you before things get out of hand. I mean, what if you can give us 5? I know we're tough on time,
okay.
But
yeah,
go ahead if you can give it, if you have it. I know this is not an easy question.
It's hard because everyone's different, and honestly, our son Jamie had been delving into prescription medication for a couple of years before we even noticed a change in him. But it's really, if you have a child living at home, Jamie was in university by this time, but if you have a child living at home who goes and secludes themselves and doesn't want you to participate in their programs at school anymore, wants you to stay away from things, those would be red flags, that things, or maybe that they're doing things with their friends that they shouldn't be doing. It's imperative for parents to engage with their kids, and we all want to give our kids a little bit of freedom, but they have to understand that if they are spending a lot of time on social media, it is detrimental. They can order drugs that come through the US mail, and kids today have no idea what they're getting. We have a huge fentanyl problem in our country around, and we are losing kids left and right, and you don't have to be an addict to overdose. You can take a drug with your friend and not know that it's laced. And everything these days is laced and counterfeit. And they have great counterfeits these days. And these kids just don't understand that. And as parents, we need to be educated. Educate yourself on drugs and alcohol and your kids in school as they grow older, so that you're there and available for them as their security. You don't have to be their best friend. You need to be their parent.
Yeah, I love that last point.
Right there. Perfect. Yeah. And Lisa, truly appreciate you coming on board today. Sorry that we have to cut you off, but again, thank you so much. We look forward to being at your comedy night May 1st, and thank you so much. And then we'll have next week another representative from the Jamie Daniels Foundation for the Hero of the Month.
Thank you so much.
Thank you for coming on.
And that's the All Access Sports Medicine for today. And again, listeners, viewers, followers, appreciate you staying on board today. It was a little bit of a heavy topic, but next week we'll make it fun and airy, right?
Yeah, I'll have my earpiece.
Yeah, fix that earpiece up.
Not work again.
And last but not least, Dr. Eric Coffman, thank you again for coming on board as our thought leader.
Thank you for having me.
Again, appreciate it. Dana, hopefully you have a wonderful rest of your day as well.
Thanks.
Thank
Sunshine.
All right.
Have a good one.
Peace out.
See ya.